Okay. Sandy, the next thing I want to do is I want to look at your teeth. And I'm going to go through tooth by tooth and describe to Linda the dental findings or the exam portion that we have there. Okay?
Mm-hmm.
And each tooth that has a filling or a crown, I'm going to talk about that. All right? That's okay with you.
Mm-hmm.
Let me first stop and hand you the mirror and show you what I'm going to be looking for.
Okay.
Okay?
I want you to look with us too, Sandy.
That's great.
I want you
Yeah.
to let us know what you see as we're seeing it.
Thank you.
Okay.
Okay.
Once Sandy is ready to fully engage herself by watching in the mirror, a shift takes place. Watch how her involvement intensifies as Sandy connects to this process.
First off, I'm going to let you tell me what you see when you look, Sandy.
Okay.
Smile at yourself and look and tell me what you like and what you don't.
Okay. Right now?
Whatever. Whatever you see.
Well, let's let
whenever.
you find what you find first.
Okay.
Okay.
Sure. Well, I talked about your bite, and I talked about how your teeth come together, and the edges of these teeth actually touch the edges of the lower teeth.
Mm-hmm.
And then we did some sliding, and your front teeth don't necessarily touch when you go to the right.
Okay.
You were hitting. Go ahead and slide that way and see. You missed these teeth, and you're actually hitting in the back here.
Mm-hmm.
Right together for me. But notice what your jaw did when you did that.
It has to shift.
Slide out to. What's it doing?
Yeah.
It's trembling a little
Yeah.
bit, huh? Bite together. Normal bite. Let's go slowly to the left. You tremble as much?
Uh.
No?
Mm-mm.
Okay.
I'm curious about something, John.
Yes.
When I'm looking at your teeth, Sandy, you mentioned the wear,
Right.
but I'm wondering if the wear is really about her bite or from grinding.
I think probably a combination of both would be the best way to look at it, because we do all know that we grind, but the way her teeth come together, they certainly can't do anything
They
but
do
grind.
fit like a puzzle. Do you see that, Sandy?
Mm-hmm.
As I ask questions to Dr. Heron on Sandy's behalf, I'm able to mirror the behavior to Sandy. This helps Sandy to know it's okay to ask questions and also understand the response Dr. Heron will have. So, although I may know the answer, it is Dr. Heron's cue to bring the process back to co-discovery.
So I think that the night guard that you do wear is a great idea for you.
Okay.
A really great idea. And I'd like to be able to look at that with you sometime.
Should have brought that with me.
Yeah. Well, we can do that another time. We don't have to do everything today.
Okay.
Yeah. All right. Sandy, one of the things I want to show you, open for me, please, is when we look at teeth, we'd like the restorations to be just like restoring your teeth. And so if we have a tooth that I'm going over your tooth now with an instrument, then you should hear how nice and smooth it is. And when I go over a restoration, I'd love to have you hear the same thing. Okay? And when I go by the restoration, I should not be able to stick my Explorer or my instrument between the tooth and the restoration. It should be very smooth and go across it. And that's one of the things that I look for. You mentioned some big silver fillings. You
See
have
them?
some?
You see them, I'm sure.
Can you see them?
Oh, yeah.
Okay. All right. I think that that's certainly something. You've had some of the teeth, though, where the silver filling's been replaced by some nice crowns. And they're tooth-colored crowns, aren't they? Do you like those better than the way they look?
Of course.
Okay. Linda, one of the things I'm seeing up here, with tooth number 1 is missing. And it was removed as one of her wisdom teeth. It looks to me like tooth number 3 is the other missing tooth that was removed after the root canal therapy.